Good afternoon, everyone. Just this little bit. Thanks for being here. We're going to talk about an important topic that Caitlin and I both feel very strongly about in the support of our patient population. We're going to talk about gender and MS. So what we're concentrating on is how our patients identify with their gender, and we're going to talk about why that matters. So we're going to work through the different variations of gender expression with you today. And again, thanks for being here. I'll pass it off to Caitlin.
Thank you. Okay. I think I have to click OK. Okay. All right. To start off with, I don't have any disclosures, and Dr. Davis doesn't have any disclosures. We both work for Norton Healthcare. Skipped ahead. You guys can't see that far ahead. Okay. So when my leader first came to me and said, I want you to talk about women with MS, I immediately jumped at the chance. But as time went on, I sat down to consolidate all of the research into a timed presentation. I found it difficult to narrow down those discussion topics. It's because there's no one way to simplify the complexity that is gender with MS, women with MS, men with MS. There's no one way to put it all together in one little bubble. So today we're going to talk about the topics you see here. This is kind of what we've narrowed it down to here for the purposes of this presentation. So to start off with, we're going to discuss women with MS. Gender roles refer to the expectations from each sex. These are expectations set by society and vary by culture. I know full well that several of you have an idea of some expectations that are set out for you based on your gender. I'm going to take this opportunity because I want some of you to shout those out. You don't have to have the mic. You can just kind of shout them out and tell me some things that are expected of women in the home. Cooking, cleaning, those kinds of things. Taking care of children. Or adults, anybody that needs care. That's right. What else? What are some other ones? Housework, that's right. What other things are women's jobs? And don't be afraid, you're not going to get in trouble for saying anything in here. The logistics, the manager. Right, okay. So everything you guys stated came from your own experiences in society. I didn't have to tell you what society thinks because you are society. You already know in the U.S. it's common for both parents to work full-time. And this does not, however, result in an equal division of labor and responsibility. The sociological concept of the second shift was coined by Arlie Hochschild, and it refers to the practice of women working a full day and then coming home and completing the responsibilities in the home as well. So how does that impact MS? Well, let's take into consideration the symptoms of MS. Fatigue, various physical difficulties, trouble with bladder, bowel, etc. Ladies in the room, you don't have to imagine, but gentlemen, let's imagine going to work all day and then coming home and doing another shift of household responsibilities, all while managing MS. It's not easy. So now that you know why the ladies in this room are so gosh darn tired, but the question is, what do we do about it? How do we make things better? Your provider is likely going to tell you to take it easy, but how do you do that? Well, it starts with communication. Communicating with your partner regarding your symptoms and how stress can exacerbate those symptoms. It sounds a little bit like a self-help column, but I swear that communication is key. If there's something in the home, whether a partner or a family member, who doesn't know the symptoms of MS and how those can impact the ability, then the partner's not going to be able to empathize with you as well. The MS Foundation publishes books, and you can get these from the library at the Norton Neuroscience Resource Center. Little plug. That's where I am. They're designed for families that can help those in the home understand what it's like to have MS and how they can help. The Norton Neuroscience Resource Center also offers MS 101, which provides education for families on MS and MS symptomology. It is provided by the wonderful Andrea Rogers. So one of the things it's designed to assist with is giving everyone a level playing field of education. The idea is that education could be utilized by the family in talking about family roles and responsibilities in the home. So now that you've been provided a bit of education on how important communication is in family, let's talk a little about something that 100% requires communication with a partner, and that's sexual dysfunction. I know. So today's headline is that women experience sexual dysfunction. You may not have realized this because it's not commonly discussed. No matter your gender, when it comes to MS, the symptoms are the symptoms. Numbness, bladder control issues, muscle weakness, fatigue, all of these symptoms can impact sex for both genders. In an article published by Mohammadi, they found, and I'm going to put the references at the end, they found that the prevalence of sexual dysfunction in female patients with MS varies from 40 to 70%. Now, I'm not going to dig into the specifics on why this happens, but I do think it's worth noting that this is a real issue for women with MS. And ladies, it's something you should be speaking to your provider about. There are things your provider can do to help you with some of the symptoms. If your sexual dysfunction is not able to be resolved with medication, there's various therapies: physical therapy, occupational therapy, pelvic floor therapy. You should also be discussing these with your partner. Sometimes sexual dysfunction can bring about symptoms of shame and guilt, and these are complex feelings and should be processed with a licensed therapist. So naturally, after addressing sexual dysfunction, we come to pregnancy. Pregnancy in MS can be frightening to say the least. A million questions run through your mind. Will I get a relapse from this? Can I even carry a child? What should I do about my medication? And on and on. The MS Foundation does a great job laying out some questions to think about before deciding to move forward with having a baby. The first one they lay out is, do I have support? The old adage, it takes a village, is very true. This is especially true if you have a chronic illness. One of the unfortunate realities of MS is that there may be times when you struggle to manage all the responsibilities that come with having a child. To quote an article by the authors listed on your screen, in women with MS, with multiple sclerosis, the rate of relapse declines during pregnancy, especially in the third trimester, and increases during the first 3 months postpartum before returning to the pre-pregnancy rate. It's always better to be safe than sorry, so speak with your family and support systems before having a child is helpful because it takes a village. It's important to speak with those loved ones when family planning, and that way everything is out in the open and you can work out a plan of assistance early. And since we're already on the topic of discussing your village, you need to include your provider. They are in your village as well. Your providers need to discuss with you your medication plan and postpartum care. Simply for the sake of time, I'm not going to go into all the details regarding treatment options for MS and pregnancy, but I just can't say it enough that you need to speak with your provider. So the last thing I'm going to discuss that directly impacts MS with women with MS is menopause. Menopause is a topic that's avoided by many, but it can be triggering. It can be frightening to think about all of the changes your body will be experiencing. But let's remember that menopause is natural and normal. It is often seen in women beginning in their 40s and is an indication that your ovaries are no longer producing estrogen. It is a change in life phase that brings the reproductive years to a close and begins a new chapter. So I think everyone in this room knows the symptoms of menopause. So, I like my audience participation. So let's shout some of those out. Hot flashes. Mood changes. Fatigue, that's right. Insomnia. Trouble concentrating, that's right. decreased libido. So how many of these symptoms overlap with MS? Oh, all of them. Oh. So it's difficult for someone going through menopause to decide themselves if their symptoms are MS related or if they're menopause related. If you find yourself in a situation where you're questioning the root of your symptoms, please discuss this with your provider. Within Norton, this could be a quick MyChart message or a phone call to the lovely nurse navigator, Andrea. I can guarantee that your provider would rather you reach out and run some symptoms past them early on than wait until things get worse. Please, please don't be afraid to reach out, and I promise your providers don't mind helping you figure out if it's menopause or an MS exacerbation or both. So now I'm going to turn things over to Dr. Davis to discuss men and MS.
I'm back. Okay, so let's talk about men and MS. So what we want to do is piggyback off Caitlin and talking about the socialization of gender norms. This applies to men as well. So we're going to learn about masculinity development and just how powerful that invisible hand kind of teaching us how to be is. And we're going to talk about the intersection and how that connects with MS symptom management and how that can interplay. So the socialization, where does this come from? How do we learn gender norms? Well, if you think about it from a young age, it starts in the home, right? Mom and dad, caregivers, and then peers, and then that whole time too, there's movies, there's magazines, there's actors, there's society, kind of everyone is teaching us how to be, and it's very powerful, right? Because of reinforcement. If we act a certain way, we're praised for that. If we act a different way, there's a consequence for that. So it kind of rigidly keeps us in this box. So I like this figure. This was brought up by Tony Porter. He did a presentation on masculinity development. It's a TED Talk. It's very good. But he talks about this box and how the kind of rigid traditional gender norms really keep us in a box. Because if we do something alternative to some of these gender norms, society, peers tend to push us back in. Okay, there's a consequence if we step out. So we're not saying everything in the box is inherently bad. That's not the goal here. The goal is the word rigid is what I like to use. So if we rigidly adhere, that can have a negative consequence a lot of times emotionally and also physically. So let's talk about what I mean by that. The concept, the gender role strain paradigm, this basically means there is strain involved in men trying to adhere to the near impossibility of checking all the boxes of traditional gender norms. Okay, so there's a couple specific ways that we talk about this. One is called discrepancy strain. The other is called dysfunction strain. Okay, so discrepancy strain, if we hold our hands out and we move our hands farther away from each other, we're building discrepancy between our hands. So you can imagine, let's not even bring MS in for a second. Let's just talk about adhering to traditional gender norms and the natural discrepancy that builds. Well, between our own experience and the models that we have, if we're not meeting and checking all those boxes, we can internalize how we're missing. Okay, so maybe it's being the provider, or it's being the tough, strong person, or being emotionally restrictive, being in control, being all of these things. That's very hard to do all of these things at once, okay? So if we're not completing all of these things, we're building discrepancy between ourselves and the model. And then when MS comes in, and MS can basically speed up that discrepancy process, because what about when there's career change? What about when there's role changes in the house? What about when there's loss of independency? These are direct contradictions to what we've been taught to be as men our entire lives. MS is really throwing a wrench in an already near impossible situation to accomplish. Now it's really making it very hard to kind of meet the traditional gender norms. So that's how discrepancy is there. And think of it as the man feeling that they're not doing enough to really fill the role that they want to fill. On the contrary, there's dysfunction strain. This is kind of the overdoing, okay? So I want to be in control. I want to be independent. So I'm not going to go to my appointment, right? I got this figured out. I'll kind of do this thing. Instead of talking about my emotions and and being expressive, I'm going to hold all that in, right? I'm going to go have a few beers with the boys, or I'm going to not reach out for support. Maybe you're doing this really well and you're really accomplishing all those traditional gender norms, but this can be having a really negative aspect on your physical health, okay? So you're checking the boxes, yet it's coming at a cost, okay? So that's the dysfunction strain aspect of this, which we can see both. We know what both are. And the idea around this is to just pay attention to this. We want to talk about this more. Okay, it's something that I'm actually doing. That's one of my research articles. I'm one of 2 people to ever talk about these things. So there's not a lot out there, but the good news is where we are within the NI, we talk about this a lot. We're actively presenting on it, as you all know. But our providers know about this. I have expertise in this. We have the team that wants to help in these areas. And these are things that therapeutically, whether it's in a group format or an individual format, we can assist with. And I encourage those to bring this up. That's something that providers kind of really lean on the patient to kind of bring up difficulties. And a lot of men, for men, a lot of emotional difficulties are directly in line with some of the discrepancy and dysfunction strain within meeting the impossible goals of their gender, right? So if we can help here, we need to build rapport with you. You need to build trust with us. And let us work with you again in any way that we can. And I'll pass this back over to Caitlin.
Thank you so much. So I wanted to start off the discussion surrounding the LGBTQ plus community by stating that I come to the discussion as an ally. I am able to state that the Norton Neuroscience Institute and the Norton Neuroscience Institute Resource Center are safe spaces, and our staff have been provided education regarding documentation that we hope is sensitive to the experiences that are felt by those who have a diagnosis of MS and are part of the LGBTQ plus community. So the task I was originally charged with was to discuss women with MS and Dr. Davis, men with MS. But we've discussed those already, and what we haven't discussed is that what those words mean. Women and men, their genders. And we would be neglectful if we did not address that not all MS patients identify as cisgender, meaning identifying as the gender assigned at birth. So I think it shouldn't come to a shock to any of you, that there's not really enough research in the arena of MS and the transgender and non-binary populations. The good news, though, is that the research is progressing, and I hope that in the next few years, I can say that there's a wealth of research. What we do know at this time is that along with other minority populations, there are recorded disparities in healthcare in general. In an article published by Amy Sullivan, patients who are transgender and living with MS have reported less comfort in discussing their sexual health with their doctors, and there is lower satisfaction of non-heterosexual patients with their doctor, showing opportunities to improve the patient experience. So what does this mean? It means that we have work to do in improving care. All of your physicians' offices and treatment centers should be safe spaces to discuss your concerns. And this is the same for all genders. As with the research statement, I hope that this is the last time I state physicians' offices should be a safe space, and that by the next time we talk, it's common knowledge. So what do we know about being transgender in the US is that it comes with extra stressors. Some of these stressors can be trauma endured as a result of homophobia, and it's also important to remember that stress can lead to an exacerbation of MS symptoms. In order to avoid additional trauma and to reduce stress, your provider should be able to provide trauma-informed care. In the context of this discussion, we're talking about trauma-informed neurologic care. And this starts with a safe space to discuss what you are experiencing medically. And this allows your physician to provide care that is cognizant of all of your symptoms. I can say that the Norton Neuroscience Institute is a safe space for you to have this discussion, and I will add that it is understood that as with any patient, trust must be built, and that's okay. Just like we discussed earlier, your providers are part of your village, and it takes time to build a village. Now, in regard to medical considerations for transgender patients, if you're considering hormone replacement therapy, you should discuss this with your neurologist so that you and your provider can develop a plan to best care for MS along with hormonal changes. So to wrap up the transgender population, I just want to say that we here at the Norton Neuroscience Institute recognize that it is absolutely a privilege to be trusted with your care.
This also includes those that identify as non-binary. So what this means is these patients don't identify as just the traditional mold as male or female. They may go by the pronoun of they rather than he or she or her and him. So how they're identifying is basically not fitting the norm, which is completely okay, and it might take a different form. So we have a few examples up here as being more androgynous, bigender, gender neutral. Okay, so the point of this is we want to show that we are open to however our patients identify, and we're going to meet you where you do identify. And we recognize, as Caitlin said, that a lot of this can come with a context of stress, a context of trauma, invalidation, that we don't want to add to. And being gender fluid. So these patients identify their gender as non-confirming. Okay, so they're going to fluctuate between different genders. They may be non-binary, but not all non-binary people are gender fluid. So it's good to keep this in mind, and it's good to know that, again, we want to meet patients where they're at, and we're okay with how they identify. We want to be a support for them in an open space, because if we're not, you think about this, adding stress, adding non-treatment adherence, that's going to negatively affect their treatment with MS, which is what we care about most.
So as you know, this topic is evolving and it's really complex. Currently, there's not very much research with MS around gender differences, and this is something we hope is a growing avenue. So we remain open as the Norton Neuroscience Institute and the Norton Neuroscience Institute Resource Center to conversations with our patients, and we hope that you are able to trust us with your care. I have included, and Dr. Davis has included here, this is a visual representation. This is called a Genderbread Person. You've also seen things like the gender unicorn as a popular illustration that kind of shows in a little bit of detail for you. So if you take a look there, that orientation is how you identify, your identity, your sex. You can kind of see it displayed there. I don't know if I have a mouse or a pointer. Does that point? No. Okay, that doesn't point. Okay. Well, you get it. Identity is the brain, orientation is the heart, and sex can be fluid as well. So take a look there. And I'll leave that up at the end. So we just want to thank you so much for allowing us to speak and allowing us for your time. There's our references. We are going to have some questions. If you have questions, and I'm going to leave the gingerbread man up there as a visual representation for you guys to take a look at. So we are available for questions.